Hello, I'm Dr. Shruti Kate. I'm a senior consultant medical oncologist practicing for the last 13 years. I'm currently practicing in Cancer Centers of America in Nashik. What causes cancer? Cancer is caused by many risk factors. Some of them are non-modifiable and some of them are modifiable. Our age, sex and heredity are non-modifiable causes of cancer. Amongst the modifiable risk factors, tobacco consumption in any form is the single most preventable cause of cancer. Other modifiable risk factors are obesity, diet which is poor in fiber, fruits and vegetables, alcohol consumption, sedentary lifestyle and prior radiation exposure. How can I prevent cancer from spreading? If you have a symptom which could be cancer, it is very important to show to a doctor as early as possible and get diagnosed in an early stage. If you have already been diagnosed with cancer, it is important that you start your treatment as soon as possible. So most important thing in preventing the cancer from spreading further is to take proper treatment. During the treatment, it is very important to ensure that we are taking treatment under guidance of an able medical oncologist or a surgical oncologist and are following with proper instructions that are given to us. Maintaining dose intensity is also very important whenever we are on any injectable or oral treatment. If you are having any side effect of the treatment that is being given to you, please go back to your doctor and take proper treatment for that side effect so that you don't give up on continuation of treatment. Regular follow-up is also very essential. At the same time, when you are taking cancer treatment, avoid using any alternative therapy or over-the-counter drugs without the knowledge of your treating doctor. So these are some small steps that can ensure that you are taking an effective treatment. Sometimes after completion of surgery or radiotherapy, we give additional treatment to increase our chances of becoming cancer free. So it is always important to ensure that we have taken treatment where the treatment has been decided by a group of doctors in a multidisciplinary team so that we do not miss out on any available treatment option that can increase our chances of remaining cancer free.